There's been a case of paralytic polio and 6 water samples testing positive for the virus in New York. All seem to be from the oral vaccine that's being brought in from other countries. Let's talk about it. Hey, everybody, it's Dr. David. So, some of our patients choose not to vaccinate for polio or have been deferring this vaccine while prioritizing other vaccines. And often I get asked about vaccines of all different types, and certainly this has been now a question that's been coming up regarding polio since these news reports have happened. Now, I approach vaccines as I do for every single medical intervention from an informed consent perspective. People should be informed, and they have to be informed before they consent. Now, I feel that all people who make medical decisions need to be informed and educated as much as possible. And that's what I really aim to do every single time I talk to somebody. So I decided to share with you what I know about this virus, about the vaccine, as well as the current situation. Now, what is polio? Now, polio is a enterovirus, which is commonly a fecal oral spread. That's how entero inside viruses pass. And this is a single stranded RNA virus. Now, there are three types, just like we've heard about variants in polio, they're called types of polio. There's one, two, and three are the three wild types. Now, types two and three have been completely eliminated from the planet in the wild sense. And type 1 only exists in Pakistan and in Afghanistan. And of course, if a person is traveling to those areas, there would be more of a concern about catching polio. I hear that the weather's lovely this time of year there. So if you're heading out to Afghanistan or Pakistan anytime soon, you may want to take this into consideration. Now, the polio that is tested positive in New York as well as in England has been type 2. And this is from the live oral vaccine that's used in some countries. We'll get into it in a little bit, but the polio vaccine used in America is a dead polio. It cannot spread the virus, but oral live vaccines, it has been shown that it can spread it. Now, as I mentioned, this virus is mostly spread through fecal oral route. People, touching people, things go, hands go here, hands go there. Very commonly more spread in under 5 years old when it was a problem, because of course those kids are not as clean, and fingers go this way and fingers go that way, and so there's more likely to get that kind of spread, hands in the mouth, etc. Now, it is less likely to happen from contaminated surfaces, food or water, and it's rarely spread through the air. Okay, so now what happens if a person catches polio? Now, 75% of people who catch this virus have no symptoms whatsoever. They could be contagious and pass it along through a fecal oral, but 75% of people have absolutely no symptoms whatsoever. Now, about 25% of people will get a flu-like illness. Regular, you talk about fevers and achiness and just some of those symptoms I get, and that can last for up to from between 2 to 5 days. Now, meningitis, which is inflammation of the meninges, which is the membrane that covers the brain and spinal cord, that can happen in about 1 to 5% of people who get polio. Now, again, of people who get polio, not of everybody in the world, it's just of people who get polio. But paralysis, which is, of course, the most concerning thing, this happens between 1 in 200 to 1 in 2,000 people who catch polio. Now, the worst type of symptoms that can happen when a person gets polio is it could affect their swallowing or their breathing muscles. And of course, that could be incredibly, incredibly serious if one cannot eat, or more importantly, one cannot breathe. Now, between 2 and 10 out of every 100 people who get paralytic polio will die from it. Okay, and of course, if you can't breathe, if you can't get food in, that would be a reason why, of course, that could be the most dreadful of all situations whatsoever. Now, treatment. There is no known treatment for polio. It is considered a completely supportive type of treatment. If you're having the flu-like illness, if you're having other kinds of muscle pains, of like regular flu types of symptom, treatments, ibuprofen, etc. Um, Now, in addition to that, physical therapy, those types of things can be helpful as well. Back in the old days when people would get really infected on their lungs, they would go into what's called iron lungs. You may have seen the pictures of these huge, it almost looks like a hyperbaric chamber, except for it applies negative pressure and allows the lungs to expand. But people would live their life in this iron lung, which of course can't. That's like not even a life. I mean, it is, but of course it's no life to have. Okay, so now what about natural protection? Now, of course, as we always talk about, is it very important in fighting off any infection to have good vitamin D levels, good zinc levels, and to have a healthy microbiome with a healthy diet that minimizes inflammation in the gut? Of course. Do I have any proof whatsoever that this could prevent polio? Of course I don't. Of course, I've never seen a case of polio in my life. There hasn't been polio in America since I've been a doctor. So this is obviously a theoretical thing. Now, let's talk a little bit about the vaccine. Now, there are two types. Originally, going back many, many years, there was an injected form. This, as I said, was not a live form. It was very effective. But then they came out with an oral live form, and this was also incredibly effective in stopping people from catching wild polio. It's easier to give. It's usually got on a little, or it's orally done, and it's done on a little sugar cube or some drops. This is more commonly done in third world countries, where it can be passed along easier. It is less expensive. Um, it is given the same way that nature gets you the infection itself. And I've talked before about, hey, wouldn't it be nice if vaccines were given in the way nature gave us the disease, because then our immune systems could react in the natural way. Okay. Now, by the 1970s, though, oh, and also the oral form would give more community immunity, the herd immunity, because again, there was some passing along of this vaccine form, this that is supposedly much, not supposedly, is much less likely to cause disease. But of course, mommy's changing diapers, other types of things, will be more community spread of the vaccine, which would provide more herd immunity. Now, why do they change back to the into the shot form, which is what's used now in America and most more advanced countries? Is simply this: by the 1970s, all cases of polio that were being seen were from the vaccine. Okay, it was a it wasn't wild, but it was a live virus. And and obviously, after so many years went by of like every single case that we're seeing is caused by the vaccine, even though it was very rare, they decided to go back to the shot, because when there were no cases of wild polio and all cases from the vaccine, the risk versus benefit of the vaccine given orally, of course, changed. And of course, going back to the injected form where it's not alive and cannot cause polio, well, that's of the reason why it went through. And I have to say, of all of the vaccines that I've given, that I have people report to, and we sometimes will have patients come into the practice who say they had a vaccine reaction. I'd honestly have to say polio was the one that I hear the least amount of reactions to, the least amount of concerns for. Okay. Now, for the vaccine itself, those who get it according to the CDC schedule on time, it's typically given at 2 months, at 4 months, and then between 6 to 18 months as a third dose, and then a booster is given after turning 4 years old. But if the third dose is given after turning four, you're not supposed to give a fourth dose. This is straight out of the CDC catch-up guidelines. Now, if an adult is going to take polio vaccine who's never had it before, the two doses are separated by 1 to 2 months, and then a third dose is given 6 to 12 months after the second dose. Now, the vaccine itself is highly effective. Two doses of the injected form would give 90% protection. Three doses, 99 to 100% effective. That's obviously good numbers. Um, Now, in terms of the oral form, it's about 99 to 100% effective against stopping wild type of the virus. Now, currently, right now, as part of the situation that's going on in England, because they've had cases in the water there too, they are actually recommending for all children to get boosted for polio, no matter how many vaccines that they've had before, even if they're considered fully up to date. That is not something that's being called for in America. Now, people have said, well, what about titers? You know, you can check vaccine titers. We check it for measles. You can check it for mumps, rubella, to know whether a person has immunity. So, yes, there are titers available, but here is what happened. So, right now, and for a long time, the laboratories only check for type 1 and 3. Why is that? Because of the fact that the type 2 really has been eliminated everywhere. Okay. And so according to the World Health Organization, many years ago, they said, well, don't check the titers for type 2 because of the fact that there is none. So all the laboratories changed to type 1 and 3, which of course is actually very unhelpful now for what's happening right now, since all of these versions that are going around are type 2 from the vaccine. So even if a person tests positive, has beautiful titers that they run for type 1 and 3, we do not know if they have protection for type 2 no matter what, unless they start changing the way that the test is done. Now, prior to in the past, I think it's been about 6 or 7 years around there, that they started going to only type 1 and 3. There have absolutely been times in the past where I would see a person have good protective antibodies for 1 or 2, but not all 3. Although most people do have good protection for all 3 when we were able to check. But even now, I will see people who maybe have good protection for 1, but not as well for 3, or vice versa. So we just cannot use titers as a completely reliable way of knowing if a person has protection against polio. And as we know, the protection is very good, anyways, even if you're not checking the titers. Okay, so now the big question is, what are people to do? And of course, this is a decision that every family, every person, parent has to be making for themselves. Now, there is no doubt whatsoever. The best way of protecting polio, of making sure a person does not get polio, is by completing the vaccine series. Just simple fact. That's how it is. Now, and again, if a person does follow the CDC schedule, you can consider yourself well protected. You don't need to be checking titers. Okay. Now, for those who are following an alternative schedule or who have hesitancy about the vaccine, and especially if they were looking at from a relevancy perspective, especially how people prioritize, because people may have heard me say before that the DTP vaccine, which is for tetanus and diphtheria and pertussis, that is, in my opinion, the most relevant to the vaccine, because anybody could step of the vaccines, because anybody could step on a rusty nail, and whooping cough is certainly still around. But a lot of people feel, well, if there's been no polio outbreaks in America since the 70s, how relevant is it? Now, of course, there has been one single case. It's been found in the water, so we assume that there's a lot more cases, just asymptomatic. So at least one can, I think it's fair to say it is more relevant to be considering getting the vaccine than if we were having this conversation even 2 months ago. Now, of course, those who are in high risk areas, places who are testing positive or finding it in the water, of course, you are in a higher risk situation than in places that do not have that type of exposure, that type of community potential. And of course, the best thing that one can do is to follow your local news sources, follow what the CDC, because it's a reportable disease, and that way you can find, perhaps set a Google News alert for, if you're around here, for Florida and polio, and then you'll know for sure it'll pop up if that's what you want to do. Okay, so of course I know that that the question of vaccine and vaccine choice has always been an issue in our country. Of course, I'm not telling people what they should or should not do, but I'm explaining that if they want to, if they are following an alternative path or who have had hesitancy in the past, at least now you have the most up-to-date information so that you can make the best educated decision for yourself. Now, please, of course, if you like this video, please, of course, subscribe. We know many people watch but don't subscribe. Please do subscribe. Please share it with others. Hit the notification button. And, of course, join us on our other social media platforms. Have a great day. Please make sure that you subscribe to our channel. We release new content every Tuesday, Thursday, and Sunday.